Most women going through a breast cancer diagnosis have to decide if they want to do breast-conserving surgery, a lumpectomy, or a total mastectomy, removal of the whole breast. A few patients have such large cancers that the surgeon can't take the cancer out and leave them with a breast that looks like a breast. And for those patients, they're told they need to have a mastectomy. Historically, more patients have chosen lumpectomy than mastectomy. But over the course of the last couple of decades, there's been an increase in the number of mastectomies. And I think that's driven by a number of factors, some of which are misconceptions on the patient's part.
It's really important that we explain to them that that doesn't mean that if we take both your breasts, that you will never have breast cancer again. Removing the breast isn't any better than doing a partial removal of the breast, a lumpectomy. There are some other things that have to go along with a lumpectomy, like the clear margin and the radiation. But for the most part, that you are going to live the same amount of time, whether you have a breast or you don't have a breast.
One of the reasons that patients might select a mastectomy is the very problem of having positive margins or having to go back. Some patients have friends and family members who have had multiple re-excisions and they don't want to go through that again. So if we can lower that rate, that could chip away at the mastectomy rate.
If you've done your first lumpectomy and failed to get all the cancer out, some people will then throw in the towel and say, I've had it, you're not going to whittle on me anymore, I'm going to have a mastectomy. And some people even say, well, since I'm going to have a mastectomy done on one side and I have a 44 triple D breast on the other side, I'm going to have bilateral mastectomies and be symmetrical. That factor does play a role in the choice of women to abandon breast conservation, abandon lumpectomy. So as a surgeon, if you can use the MarginProbe and get the cancer out the first time, then in effect, you've reduced the fear factor, and I think you'll reduce the number of people choosing to have mastectomies instead of lumpectomies.
I think that using the MarginProbe, I can more readily tell my patients that I have a really good shot at getting you through this with clear margins in a single operation.